Navigating the onboarding process for new staff in a hospital can be an absolute punish. New hires often struggle with overwhelming amounts of information and inefficient systems. How can hospitals make sure that staff are well prepared and not just tick a box? Can you imagine the impact on staff retention and patient care if we just get that onboarding process right? In this episode that I recorded at Digital Health Festival 24 in Melbourne, I speak with Dr Rob Pearlman from MedApps. And in this episode, we talk about how MedApps enhances onboarding and daily engagement for clinicians, the integration of clinical insights and coding into the MedApps solution, and you'll hear some real-world examples from Alice Springs and other regional hospitals showing the benefits of effective onboarding. Collaboration starts with the conversation, Team HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
G'day, Rob. How you going?
G'day, Pete. Yeah, really well, thanks. Yourself?
Yeah, really good. Look, enjoying time here at Digital Health Festival. It's been great to see a lot of people, but most importantly, getting an opportunity to chat with you, man. So thanks for swinging by the booth. Look, it's been a while since we've checked in about MedApp on the Talking HealthTech podcast, so exciting to dive into it. Firstly, maybe for those that don't know you, tell us a little bit more about you and what you do.
Yeah, so my name's Rob Pearlman. I'm a doctor and the founder of MedApps. MedApps is, the company is MedApps, the platform is MedApp. That's a little bit interchangeable at the moment. We're an orientation, engagement, and onboarding platform. So hospitals buy MedApp and roll us out to their clinicians. So originally that was just your junior doctors, interns, residents. Now increasingly it's the nursing workforce where this is a really big problem. And also really anyone in the hospital who has patient contact.
And your background, you're clinical as well, and also a handy on a keyboard. So that's a bit of a wicked combo.
I guess... nothing's a bit more dangerous than a doctor who thinks he knows how to code. So, but it certainly enabled us to get through to I guess, begin the journey.
Yeah.
And one of the exciting things recently has been actually taking a little bit of time to go and scratch that coding itch. The developers have put in some pretty rigid railroad tracks that I've got to follow now. So it's not the Wild West like it used to be. But one of the pleasures I've had this year and late last year has been pushing out some new code for some new features. Okay. So it's, we're a small team. Our development team's 5 in total. So being able to come in and pick a feature that's been, that I think that the users are going to benefit from and developing that and roll that through to production has been really exciting and enjoyable for me. It's not where I'm the best use of my time, but it is great to also spend some time with the developers and understand what their problems are, and then it also helps us construct more realistic timelines around our development priorities and what we can deliver. So it's mutually beneficial.
Yeah, I love how you're a little bit like me from what I can tell. There's one way to get to know a problem is to do it firsthand, and so with your clinical work that you do and still seeing patients on a day-to-day, and then actually engaging with the tech, it's one thing to have a vision of this is what I reckon people might want, but if you're feeling feeling it on a day-to-day, that's got to be more meaningful and more impactful, so that would drive a lot of that growth, I think.
Yeah, definitely. I've also been back in the emergency department a little bit more, so that's been really great.
Yep.
It's always good. One of the departments I've been working at has recently adopted one of our recent features. So MedApp was traditionally been, I guess, the handbook through which you're introduced to your hospital. Increasingly, we've got hospitals that are using it to run certain assessment programs. And, there's nothing like sitting down in the emergency department and one of the emergency consultants comes up, taps you on the shoulder, and then sits you down for a 20-minute lecture about there's some of the things you could do better.
You know what you need in this?
But that was awesome because I was able to video it and send it onto the product team and get that exact feedback. The things they like, the things that they wish they could do better. And I guess there's not many organisations that get to be able to close the loop between the user and the product manager as tightly as that.
No, that's really good. And actually, on that point of the user, so, it's who's the actual kind of end user? It's as you say, it's the clinician, the one, because you're using it for your onboarding and engaging on a day-to-day. Is there something for the hospital system as well to engage in as well?
Yeah, so I guess there's all your clinical users, and then you've got your administrative users as well, and a bunch of reporting that comes out of that. So increasingly that reporting is being put together and provided to hospital accreditation providers or as hospitals go through their accreditation process. And that's an area that hospitals are telling us they're saving an enormous amount of time. It's very complex, painful procedure going through a hospital accreditation. So being able to provide the evidence to the accrediting bodies in a really easy way has, it's been great. And we've had some really good partners in that. So I've given you the example of myself in the emergency department, but we've actually co-developed a number of pieces with some various health services. So Central Queensland Hospital and Health Service has been, we've had a particularly close working relationship and really value the opportunity to sit down with them, send up some of the product team to talk specifically about the problem. The product team can come back and I can give them my take on when some of the prototypes, and we've been able to roll out and iterate in a really, really innovative way, I believe, but also roll in some other hospital and health services that have the same problem. And so the model is, we know there's a big chunky problem out there that's causing a lot of angst. Find an initial launch or development partner, find several other health services that have the same problem, and make sure that we're rolling it across many of them at once we've had that initial beta launch or alpha launch, with the knowledge that they're going to give us the tight feedback first and we'll iterate as rapidly as possible. So the health services we've worked there really closely with has been not just Central Queensland, but also Metro North Hospital and Health Service. We've got 400 of their junior doctors at Royal Brisbane Hospital are currently using MedApp to complete their intern assessments. There's been over 2,000 of those assessments completed in just the last couple of months. And Alfred Health in Melbourne on a similar feature set for their remote recall times. So for the Alfred, there's been a lot of change and quite progressive in Victoria in terms of the Junior Doctor Awards, which has a major contribution into junior doctor burnout and mental health. Victoria has introduced remote recall, which means that if I'm an on-call registrar and I am called up in the middle of the night or in the evening, then I'll record that and I'll be paid for that. Previously, there was not often an on-call fee, and people were just doing it because they're on a call, and so the total numbers of hours they were working wasn't necessarily being known. What that entails, obviously, is you've got to record when you get a call, and it is, writing.
I would imagine it's not the most convenient time to write it. When you're like middle of the night type stuff.
So we've been able to work with them to roll out a logging component into MedApp, so they can jump off the call, jump in, type in some details and submit it. And we're continuing to iterate down that pathway, but the feedback that we've got from them so far has been really good. But that sort of tight relationship where we can say, okay, we understand this is a chunky problem. We know that other hospitals are going to have this. Let's solve it for you. But most importantly, let's solve it for the clinician, because it's their pain points that we're solving for. Administration wants to make it easier for them, and they've got a need to capture this information. But really, for us, it comes back to what's the problem for the clinical user. And if you're not solving that, then you're going to be left behind.
Yeah, absolutely. It's
I love hearing the stories of the implementations, the executions. It's, and the example you used up in Queensland with the different HHSs and learning from one and kind of expanding out to other and being able to iterate rapidly. You mentioned the Alfred example as well. Are there any other examples or use cases of customer journeys you can take us on?
Yeah, well, one of the another really awesome opportunity that I guess is feel-good opportunity for us has been Alice Springs. So Alice Springs Hospital is obviously, it's in Alice Springs, if anyone doesn't know, and one of the issues that they've had, particularly in the wake of COVID, has been, and it's not just Alice Springs, it's been many regional health services, is they've had an increasing dependence on locum and agency staff, so casual staff who are rolling in because it's been difficult. People are still very burnt out in the wake of COVID, and they were using up to 50% of their workforce in the emergency department was agency staff, so casual staff who are there on short-term basis. What that meant is that there were nurses turning up every couple of days that would require induction and orientation. And for the small nursing leadership group inside of the emergency department, they were spending a lot of their time having to sit down and manually, individually go through the processes and make them feel welcome to the department. We sat down with them and we said, well, we can solve that for you, and put together a program. They've been completely independent in the usage of that and have now put through more than 300 staff over the last almost year that has saved the department, on the order of 20 to 40 hours of administrative time each week. But also, so our core belief on the orientation side is if you can provide a really great orientation process, onboarding process, then you're going to get better staff engagement. You're going to improve your clinical care. But more importantly, particularly for regional areas, you're going to improve your staff retention. So that might result, if they've got a smooth coming in process, then maybe they'll come back to the same department where they're going to be more effective in the future, or maybe they might consider moving there longer term. So that's been immensely satisfying for us, and we've been able to replicate that again at a number of other regional sites. Regional medicine is something that's very, very close to me, as you know, Pete, growing up in the country.
Nice.
So it's really good to be able to do something that's contributing to the level of care that our regional services are providing.
I mean, that's got to be a big problem everywhere across the country, and especially in the regional areas. But there's a heavy reliance on agency nursing workforce in every hospital. And if they're coming in and going, and someone else comes in again, that as you said, the onboarding, that's so important, that first little bit. And so often in any organisation, we kind of just chuck people in and they go, oh, it didn't work. And it's kind of like, well, you didn't set them up properly. And if we can get that bit right, then all those things kind of flow from there.
Yeah, that's right.
Cool. And in terms of then, we're here at Digital Health Festival and all the different stakeholders within the health tech ecosystem, they're coming together. What's the vibe? You've been out and about having a chat, meeting with some customers and partners. What's the vibe here at Digital Health Festival?
Look, I've got to say is electric. Is electric the term?
Yeah, they'll use that in their marketing.
Yeah.
It was electric.
What it's been great to catch up with so many people. In particular, we've got two of our New Zealand partners as small health tech organisations, so CELO and Core Schedule.
Yeah.
So a new partnership, I guess, we're announcing on the back of this conference, but we love what they're doing. We love the Kiwi spirit. I don't like playing them in the rugby, but that's okay. And we've they're kicking goals all over the place. It's great to catch up with them, and we'll be hoping to be able to present a number of other useful sort of adjacencies, which is what we consider CELO, clinical messaging, and core schedule, team rostering around MedApp, that makes it easier for hospitals to jump on board and take advantage of those great products.
Yeah. Well, that's an interesting point in itself, isn't it? That whole, where that onboarding process and the bits and pieces that MedApps do, it's kind of once you do such a great job on the MedApp app, you don't want to kind of leave everyone high and dry. And if it doesn't connect in with anything else, it's kind of like,
Yeah.
That's good, but then it stops. So
What I'd say it's collegial. It's an electric atmosphere, but there's a collegial spirit.
a lot of good quotes in this one. It's good. It's good. Well, look, it's always great to catch up. Rob, we'll put the details for MedApp in the show notes of this episode, and look forward to checking in again soon. Thanks so much.
Cheers so much.
Thanks.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.